So my role when I was in the clinic was translating from French-speaking patients to English-speaking doctors. And there was one afternoon where a patient came in who was from the Congo, who was a French speaker. She was a woman about my mom's age, and it was a really, really long appointment with the doctor. And she came in because of a torture wound that she suffered many years ago when soldiers had cut her open and stuffed in steel mesh and then let it become inflamed and swollen. It had cut into some of her organs. So she had a nasty scar, and the doctors were trying to find how they can help her. So we had this long session explaining the whole experience she had. And then the doctor went to get painkillers. And while the doctor got painkillers, she asked me for a glass of water. So I went, I gave it to her, and already I was feeling completely useless. I was thinking, never in my life can I imagine that this could happen to someone else, and now I'm giving like a useless little thing to help her. And when I give it to her, I say, "You're welcome." And when I was talking with her about the water, I used a polite way of talking for strangers, for people you don't really know, maybe someone you respect, vous instead of tu. And she started sobbing. In the whole session with the doctor, she hadn't cried once. And I had been holding tears the whole time. And I thought she was in pain. I thought, should I go and get the doctor? I asked her. And she said, no, like everything's fine. I'm not used to hearing people call me this way, because in the past many, many years, no one's ever treated me with respect. They thought, this is what your story is, you're here, you're like an animal, and you're not worthy of it. And she told me, having a teenager talking to me like this is something I haven't imagined for a long time. And when she told me that, I thought, okay, so whatever I do, this conversation, I'll keep using vous, I'll keep respecting her, because clearly it's having a big impact. And so we talked, I gave her more water, the doctor came, and when she left, I couldn't stop thinking about that afternoon and that story where for the 2 hours of explaining all the torture she went through, she never once cried. And then as soon as I addressed her politely, she started sobbing and she was hugging me. She was saying, like, God bless you, like God sent you here just for me for this moment. I was thinking, I'm not even a doctor. I'm not even saying I can help you with your injury. All I'm doing is saying, like, have a nice day. You're very brave. Good luck, politely. And she's having this intense reaction, which made me question my words so much more. And I used to like to talk a lot, but after that, I thought I have to watch every time I talk, because I'm never knowing if it's having this kind of effect, or if I imagine looking back, I accidentally used an informal way, and then she would just keep feeling like no one respected her. I became so much more quiet and listening after that, and always thinking, okay, when I speak, am I speaking politely, respectfully? Am I choosing words that are making someone feel as important as they should feel? When I used to just talk nonstop. And this afternoon, I just couldn't shake realizing that a quick instinct of how I talked changed the whole afternoon and gave us this moment where she was crying and I was crying, all from this word, and not even from the story, not even from her wound, not from pain, but just from this useless thing, which for me seemed useless. I'm thinking, all I can do is speak, but for her, where speaking was such a powerful moment, and it made me think, like, if for the rest of my life, I just am in situations where I can speak politely, and people have this reaction, like, that's all I could want. I would never want to have any more skills.